Welcome back to the Lost Book of Herbal Remedies. I'm Alex, and as always, I'm joined by the lovely Emma. Today, we're diving into a topic that affects millions of people worldwide: COVID-19's lingering effects on brain cognition, or as some call it, long COVID. This is a huge deal, right, Emma?
Oh, absolutely, Alex. Long COVID, or post-acute sequelae of COVID-19, PASC for short, has left many people struggling with what's often called brain fog, memory issues, and concentration problems. These cognitive symptoms can linger long after someone has recovered from the virus itself.
Right. And studies suggest that 10 to 20% of people who recover from COVID-19 experience these issues. So today, we'll be breaking down how exactly COVID-19 impacts the brain and the role of neuroinflammation, which is a key player in this. We'll also look at the critical role of the brain's immune cells, called microglia, in both protecting and sometimes harming cognitive functions. Let's start with some context. We've heard about COVID-19's impact on lungs, the heart, and other organs, but the virus also affects the brain in some profound ways. This long-term cognitive fallout is often called long COVID, and it manifests as things like brain fog, where people have difficulty concentrating or remembering things.
Yeah, and it's not just severe cases of COVID-19. People with mild symptoms can experience long-lasting cognitive effects, too. What's really at the core of this is something called neuroinflammation. It's your body's immune response that kicks in during infection, and when this happens in the brain, it can lead to all sorts of cognitive issues.
And this inflammation isn't just random, right? It's actually driven by the body's immune system as it tries to fight the virus, and it's particularly active in the brain. But the problem is, too much inflammation can mess with your brain's ability to adapt and function properly.
Exactly. During COVID-19, your immune system releases these inflammatory molecules called cytokines, like IL-6 and TNF-alpha. When this happens in the brain, it disrupts the communication between neurons and damages synapses, which are crucial for learning and memory.
So, neuroinflammation can essentially short-circuit the brain's wiring, making it harder for people to think clearly or retain information. That sounds pretty alarming.
It is. And this is where we start to see how complex the brain's response to COVID-19 can be. Even after the acute phase of the infection, these cognitive symptoms can persist for months.
Let's zoom in on something really fascinating: the microglia. These are the brain's resident immune cells, and they play a vital role in maintaining brain health by regulating inflammation and repairing damage. They're like the brain's cleanup crew.
Yeah, they're so important. Microglia are responsible for a process called synaptic pruning, where they eliminate weak or unnecessary synapses to keep the brain efficient. This is key for neuroplasticity, our brain's ability to adapt by forming new connections.
But here's the catch. During COVID-19, these microglia can become overactivated. Instead of helping the brain, they can cause more damage by pruning too many synapses or triggering excessive inflammation. It's a delicate balance. If it tips too far in either direction, it can lead to cognitive decline.
Right, and this is exactly what we see with long COVID. The microglia that should be helping to repair the brain end up contributing to chronic inflammation. It's like they get stuck in overdrive, and that keeps the cognitive problems going.
And because microglia play both protective and potentially harmful roles, the big challenge is figuring out how to restore that balance, so they stop contributing to neurodegeneration and help the brain heal instead.
It's so clear that COVID-19's cognitive effects can be devastating. We're talking about memory loss, difficulty focusing, and sometimes even impaired decision-making. These symptoms vary widely from person to person, but the one constant is that they're making life really hard for survivors.
Yes, and research shows that the severity of your original COVID-19 infection can determine how bad these cognitive symptoms are. So people who had more severe cases tend to experience worse cognitive outcomes during recovery.
And it's not just memory problems. We're seeing deficits in executive functions, things like planning, problem solving, and attention span. That's why rehabilitation strategies need to be personalized for each individual. What works for one person might not be as effective for another.
And then there's the brainstem, which we don't often hear about in discussions around COVID-19. This is a critical part of the brain responsible for controlling things like breathing and emotional responses. In some people with long COVID, inflammation is showing up in the brainstem too.
That's right. Imaging studies have revealed that areas like the medulla and pons are more vulnerable in COVID-19 survivors. Damage to these areas can lead to ongoing symptoms like fatigue and cognitive deficits and even emotional instability. It's like hitting the brain's central hub of control.
This really highlights how complex and far-reaching COVID-19's impact on the brain can be. When the brainstem gets involved, it can affect everything from mood to physical coordination.
This is so important because we're now starting to see evidence that COVID-19 might affect kids' ability to hit key neurodevelopmental milestones. That could mean trouble with learning or even an increased risk of psychiatric disorders later in life.
This is so important because we're now starting to see evidence that COVID-19 might affect kids' ability to hit key neurodevelopmental milestones. That could mean trouble with learning or even an increased risk of psychiatric disorders later in life. Let's now touch on how the virus actually gets into the brain in the first place. It turns out that SARS-CoV-2 can break through the blood-brain barrier, which normally protects our brain, through different mechanisms, like entering via the olfactory bulb or the bloodstream.
Once the virus is inside, it triggers a cascade of inflammatory responses. These responses include that infamous cytokine storm, which leads to neuronal damage and disruption of normal brain function. Essentially, the brain becomes overwhelmed by inflammation, and that's when cognitive symptoms start to manifest.
Now, this next part is really interesting. COVID-19 doesn't just affect memory and concentration, it can also impair our reasoning and decision-making. These are called higher-order cognitive functions, and when they're affected, it can change how people interpret information and form beliefs.
Yeah, and it's not just about day-to-day decision-making. Impaired cognition from long COVID can lead to things like susceptibility to misinformation and even conspiracy theories. People may struggle to critically evaluate evidence or tell the difference between reliable and unreliable information.
All right, now on to one of my favorite topics, herbal remedies. COVID-19's cognitive effects can be debilitating, but there are natural ways to help support brain health and manage neuroinflammation. Let's break down a few herbs that could make a real difference.
First up is curcumin, which is found in turmeric. It's a powerhouse anti-inflammatory and can actually cross the blood-brain barrier, reducing inflammation in the brain.
And then we've got omega-3 fatty acids, which are fantastic for brain health. They reduce inflammation and support neuroplasticity, helping the brain form new connections.
Another great one is Ginkgo Biloba. It's known to enhance memory and improve blood flow to the brain. And don't forget lion's mane mushroom, which helps stimulate the production of nerve growth factor, essential for repairing neural damage.
And if stress is exacerbating those cognitive issues, ashwagandha is a go-to. It's an adaptogen that helps manage anxiety while also supporting brain health. Plus, there's resveratrol, which has antioxidant properties that protect the brain.
These herbs aren't a cure, but they can certainly support cognitive recovery. As always, consult a healthcare provider before starting any herbal regimen, especially if you're dealing with long COVID.
Well, that was a lot of ground to cover today. From neuroinflammation and microglial dysfunction to herbal remedies that might support brain health, it's clear that COVID-19's impact on cognition is complex, but not unbeatable.
Absolutely. If you or someone you know is dealing with these cognitive challenges, don't lose hope. There's research happening every day, and natural remedies can definitely play a role in supporting recovery.
Thanks for joining us today. Be sure to check out the full article on herbalbloom.org for even more insights, and stay tuned for our next episode of the Lost Book of Herbal Remedies.